Okay, thank you. Thank you all, and thank you for your cooperation. Welcome to this open day and the launch of our home care report this afternoon. We, as I said a while ago, it seemed like a good idea when we planned to have 2 sessions in one day, one morning and one afternoon. I'm not sure I'll do that again, but you live and learn. So this afternoon there'll be 2 elements. We will give you a bit of history of SACHMA and talk a little bit about future developments for the organisation. But the core really will be to share with you the key findings and the recommendations from the report that we did in partnership with Sheffield Health Watch as part of the Speak Up grants. So we are going to have done this. This will be our second time of doing this today. So, and it's filmed, so you can maybe check and see if we got it right both times. But I think it's really worth saying that as an organisation, SACHMA, we haven't done an open day for many years, and of course we've had COVID. So particularly people who are here this morning, were really keen that we were able to meet face to face. But we really want to keep you updated on what we're doing as an organisation, what we've done and where we are going, and also to share this report on the basis that we definitely want this to be something that makes a difference and isn't just a one-off piece of work that ends up going nowhere. In terms of housekeeping then, bit late for that. So masks, you don't have to wear masks, but it's entirely your choice if you wear a mask. If I can just ask that you check your mobile phone and make sure that it's off or on silent so that we aren't disturbed. The conveniences through this door here, there's male and female, and through that door to your right there's another set of toilets. This is the exit here. We can't go out through this way today. There isn't a fire alarm planned, so we will move out in an orderly fashion if there's a fire alarm behind me, and we get across the road. And hopefully you've had lunch if you wanted lunch. So let's move on to SACHMA's history. So I was sharing with the people who were here this morning that we are coming from a long way. SACHMA as an organisation began in 1988 in this very building. And we started as a result of 2 members of the community who had loved ones who were in the mental health services, and they felt that the treatment that their loved one was getting was less than satisfactory. In many regards was abusive. They didn't know where else to go. This was the 80s, and so they came here and sought out the community worker, who then mobilised a group of people from the community to look at how we might respond to the mental health needs of our community. And that coincided with the same sort of experience all over this country. So in the larger conurbations where there were significant numbers of people of colour, significant numbers of African Caribbean people in particular, we're all making the same comments about poor treatment in the mental health services. And so we met together, we talked, we decided what we would do, and visited an organisation who was further down the road than Sheffield was in London, called the African Caribbean Mental Health Association, who at that time was led by Dr. Errol Francis. Forgot for a minute there. So Errol Francis led no heckling from the cheap seats, please. So we forgot that with Errol Francis led that organisation, and their approach was very much around a holistic approach to black people. So there was good access to legal services, housing services, people who were qualified in health and social care, so social workers and mental health nurses, all formed part of the African Caribbean Mental Health Association. And the ethos of that association, which we adopted, was that it would be African Caribbean people supporting African Caribbean people. So anybody accessing a service at SACHMA in Brixton it was an African Caribbean person that was delivering their services for them. And we basically adopted that model in Sheffield and worked in that way for a long time. We developed partnerships around supported living. So we had 15 supported living properties. We had advocacy workers who worked on the wards and who also worked in the community. We had community outreach workers. We had we've been in various locations where we were able to deliver things like women's groups and carers groups and a lunch club. None of this was new or particularly different from what other organisations were doing. The difference was the African Caribbean face, the African Caribbean perspective, people generally not having to explain because there was a degree of commonality. And so we went along and did well, and then 2010 came and austerity hit. And I shared with the colleagues who were here this morning, I'll say it again now, that the experience in Sheffield, it felt to be a calculated cull of voluntary sector organisations by some officers in some organisations. That's how it felt to be on the receiving end. Whether that was their perspective or not, I don't know, but it felt determined, it felt intentional. And that was for the whole of the voluntary sector, but black-led organisations were particularly hit. So at that time there were 11 African Caribbean-led organisations in Sheffield working across, you could say from cradle to grave, from young people to youth services to education to older people. There are now 3, and none of those have really robust funding arrangements with parts of the statutory sector. Have bits of grants and bits of contracting, but nothing substantial and robust that you can say 5-10 years ahead you know what your financial profile looks like. I think that's something for the city to be ashamed of, and I think that as citizens of the city it's something that we should challenge, because we all contribute to the city. We contribute our skills, our talents, and we contribute financially, and that's part of the challenge that I think we are making to the system as an organisation. So that's where we were. I'm going to invite colleagues who are here from the team here at SACHMA to join, and they'll come as needed to just share where we are now. Desna is unwell, so she can't be here today. So we have a small contract with the Health and Social Care Foundation Trust around befriending. And so Desna works across the Michael Longley site, the Carlisle site and Forest Lodge, offering befriending services to people who are on the ward. It's been a challenge during COVID because obviously external people are only just now being allowed to go in, but we still have that. It is a very, very small contract. Next slide, please. Sonia's here. She's telling me she's shy, but it's not something that I experience on a daily basis. But I'll go with it. I spoke about austerity, and we were told that this was going to be the way, particularly with the City Council, that that they would engage with us, that our organisations would be funded, and we would move to doing work around support plans for people who have had an assessed need. So the local authority would assess somebody's need, and then it was put out to organisations like ours to turn that assessed need into a support plan. And deliver that. And that's how we were going to engage with the City Council. It was never a financially viable option. In Scotland, when they introduced the whole notion of personalisation and self-directed support, they built into the budgets there enough for organisations to have their infrastructure costs covered. That didn't happen in Sheffield. And so we have carried on doing what we are doing purely because of the commitment of key people. And our chair of trustees was here this morning. She's left. Celia ran SACHMA for 4 years at no cost to the organisation. Had she not done that, had there not been good fiscal decisions made by the trustees in the lead up to 2010, like many of the other 11 organisations that I spoke about, we would have gone to the wall as well. Thankfully we didn't. So we offer the whole service around managed budgets. So we will manage people's individual budgets for them, be that mental health or in adult social care more widely, or in disabilities. We will recruit and train and support personal assistants who deliver the support in the homes. And there was a comment made this morning about personal protective equipment during the pandemic, and you'll have remembered all the coverage in the press about the NHS not having enough personal protective equipment. Well, the NHS didn't have, then social care generally had even less, and then those working in direct payment, self-directed support had virtually none. For our organisation, charities gave us face masks and gloves and visors. In the early stages of the pandemic, that's how we were able for our PAs to carry on doing the work in people's homes. It shouldn't have been like that. It just should not have been like that. And I think I'm very proud of the fact that none of the people that we're supporting lost any of their support during the pandemic. We never had to put anybody on furlough, and there was only one of the budgets that we managed who had to make some changes for his staff team. He's a very big staff team, I think it's about 8 or 10. And the reason he had to make those changes was because his PAs had roles in health as well, and he was concerned about cross-contamination. But everybody carried on. Despite the difficulties, they carried on delivering. And so we will work with anybody who has a personal budget and support them through that. We'll do work with the making sure they've got employers' liability insurance, make sure there's work, the liaison that needs to happen with the tax office happens, their tax is paid. All of that we do. And I think it's really important that service is offered, because many of the people who in name are budget holders don't have the capacity to actually do the work, and so they need support. It might be that dementia is present, it might be there's a range of things that mean that they're not able to do that, so they need the support to be able to meet their requirements of having a direct payment, and so we do all that work. And Sonia leads on that for this organisation, and she takes responsibility for our administrative support, supported by Jack. Jack isn't here today because both he and his wife have tested positive for COVID, so that's why Jack's not here. Next slide, please. Yes, give Sonia a cheer. Yeah. So as I said at the beginning, mental health has always been a challenge, and how the system responds to us in terms of mental health difficulties. And it was very clear that people of colour, particularly African Caribbean people, very rarely, if ever, were offered counselling as part of their treatment plan. It just didn't happen. And there was lots of reasons for that. I don't suppose you want me to ventilate those now, and I'm not going to. But that's not our view. And so at the end of 2019, beginning of 2020, we were able to juggle finances and set up a counselling service within the organisation. So we have 4 counsellors in SACHMA, 3 African Caribbean and 1 white European, and 1 African Caribbean woman who offer counselling sessions. We offer 6 free sessions to people needing counselling. If beyond the 6 there's a need for more sessions, then we will work with the person to identify the best place to get the funding for them to continue their counselling session. In addition to that, we have a partnership with Sheffield Mind that they hold 5 counselling spots for SACHMA to refer direct into every year. So if somebody comes to the organisation and they're not overly concerned about the ethnicity or the gender of the person who will provide the counselling for them, then we can use those spaces at Sheffield Mind. And that's a really valuable service. I need to get my stats right. I think since we started, we've supported 11 people, and we have 3 people who we're supporting at the moment. Next slide, please. I think it's time for me to sit down and let somebody else have a word. So I'm going to invite James and Corinne to come and just talk about the community outreach. Thank you.
Testing. Is it on? It's not on.
Do you want to use this one? Corinne, do you want to use this one?
Oh, yeah, let's have a look. I'll use this one. Okay, testing. Excellent. Good afternoon, folks. Yeah, we're really happy to see you. Glad that you could find time to come down to our open day. So, I'm Corinne. I've worked in community organisations, charities for years and years and years. Over 30 years, So I'd say I do know what I'm doing. I came to work for SACHMA in April 2020. So I'm a recruited lockdown worker. But as David said, we were not furloughed. So we worked throughout. And we helped and supported people throughout. That's part of our ethos. It's really interesting, really beneficial work, and we're a good team. Part of my work involves, as other people have said, I do telephone support, I do one-to-one support, I support people who are not in a good place emotionally, a lot of the time physically, spiritually as well. So we are there to help and support people throughout. I do visits. James, my colleague, we both do visits, and we listen to people, communicate with them, and we help them to get through. We are working with people who are going through a very bad time for a lot of them. One thing I say is that sometimes we get referrals in and we're told that people are, quote, hard to reach, unquote. And I always say, no one is hard to reach. No one is hard to reach. We have to persevere and keep going time and time and time again. Some people will get the message straight away. Others, it takes more time. But no one is hard to reach. We're there for them. Another thing that we do is activities. We do activities in the community. We've got a really nice social cafe and lunch club, which runs on a Thursday. And as a team, we're there doing activities and things. James will explain. We do, there's all sorts there. People come. They see people they haven't seen in a long time because people are getting used to coming back out and seeing what's going on, talking to other people. They come, they have a nice meal. They have a really nice meal like the one you had today. And, it's a good place. One of the really nice recent things we did was we did a short trip on the Tinsley Barge Canal. Really nice. Tea and scones. It was wonderful. What's not to like? So, yeah, that's, one of the good things. And when you do things like that, you hit so many positives. And people will always tell you, they'll always remember what a good time they had. I think that as a team, what we're doing is adding so much value. SACHMA adds value to people's lives. We're helping people to manage themselves, manage their lives, and we're supporting people who are and who have been through trauma. It's such a rewarding thing to do. And as a team, we're doing this with such care, understanding, and compassion that, you know, it makes everything worthwhile. Thank you.
So I'm James, and without just repeating everything that Corinne said, but I know you're all dying to hear what she means by the events we have on the social cafe. So we recently had a talk on dementia, so we have lots of different people come in and give expert information about services they do and provide. We've recently had meetings to create a collaboration with Move More to bring stuff in. We have chair aerobics and stuff like that. And does anyone like bingo? There we've got bingo on as well. But to add on to other parts of my role, I'm involved in doing research highlighting mental and physical inequalities in Sheffield to create a local picture and to bring a spotlight onto it as to what is doing, what's not being done, and what needs to be improved, and have physical evidence that you can hand to someone and say, this is a problem, you can't ignore it. So I'm involved in creating that research, doing it, and finding all the information, collaborating it, and we'll have a presentation with it all when it's done. But yeah, so that's me in a nutshell, really, echoing Corinne and this further research. And next slide.
Thank you very much.
Yeah. Okay, good afternoon. Oh, that's much better than this morning. I got silence this morning. Thank you. I was going to say, if I didn't get an answer this afternoon, I would just say, it's all right, I won't push it. But thank you. I just want to start on a personal note. I can't put years on it, but as a family, we have benefited from the services of SACHMA for, all right, I'm going to be conservative and say 20 years, but I think it's probably longer. So, yeah, 20 years probably. So, you know, on a personal note, we're, as a family, really grateful for this service. I remember when my mum was alive and she was my brother's main carer, she was absolutely delighted that there was this organisation in the community that she knew them. They knew her. They knew the family. They knew my brother, Keith. You're not Keith, right? They knew my brother, and they cared. They cared about her life. They cared about his life, and it worked beautifully for her. As a family, we're still benefiting from the services of SACHMA through SDS. Yeah, through SDS. And very, very grateful that the organisation remains and it's still as effervescent and impactful as it ever was. I think around January this year, it wasn't me, so around January this year, SACHMA employed their first information and communications officer. And that person worked around, and I'm developing that work, that person worked around improving the quality of information that was shared with the community, particularly around health, through online platforms and the work of the community champions, through some engagement work that we were doing as well. So a lot of the work was around COVID-19 protection and prevention. But we've had two particular events that have been quite impactful in this area, and we've had two webinars. Earlier on in the year, we had a webinar that was entitled "What's Faith Got to Do with It?" And then last week, we had a "Why Wait" webinar. And both of these were conversations around how we were approaching and managing and getting through COVID and the lockdown, and coming out of lockdown even, as a community. So the What's Faith Got to Do with It recording is on our website, and very soon the Why Wait recordings will be on the website, so please drop in and have a look. We're also doing a lot of work around improving the quality of our literature, so please read your little pamphlets and remember that somebody spent a long... No, I'm joking. I am joking. You don't need to remember that. But we're really working on trying to improve the quality of our literature and how we're communicating with our community and beyond. Another key point... Well, that's the dissemination sort of work that we do as well. In terms of communication, I think it's important to say that our focal point of communications is the work that is done by people like David and myself to a large extent, and Corinne and James and Limbal that's coming up, and Desna. It's the work that we do face to face with the community. Okay, that communication is really important. But as we move on into the future, you will see our social media platforms developing, and the range of information that is there growing as well. And that's me. Thank you.
Hi everybody, my name's Limbal. Just like to say hi, how you doing, welcome, wagwan, bless, touch me. Right, I'm an advocate. I do advocacy for people. Well, an advocate is someone who will speak out for somebody. An advocate is the one who likes to be that person's voice. I've had the opportunity to visit some hospitals and to work in hospitals with people who are suffering or going through the mental health on Section 2 or Section 3. Not only do I work with people who are suffering or going through mental health issues, I also work with the families as well. And a lot of the time working with these families, the language between the consultants and the nurses, it's a bit too technical. So I've been advocating on their behalf for them to change the way they speak to people. I'm dealing with one case at the moment that the person I'm dealing with, her first language is not English. So when the letters come, it's so difficult for us to read and to understand, what do you mean by this? We've had a couple of meetings, but they've now agreed, so they will telephone her and talk to her and speak to her regarding that way. So that's part of my job as an advocate. I also help do a lot of work with Corinne in the day centre, what we do. And what I like to do is when I visit my clients and their families, I invite them along to the day centre, because it's like a big open space where we do different clinics and talk with people about certain things. I even got to a stage where I'm filling out PIC forms for people, which is, it's the first for me for doing that, but it's actually helped them because the language on the PIC form is very difficult as well. So part of being an advocate is not just speaking out for people, it's also helping people as well. And that's me. Thank you.
Okay, thank you all. I just want to take a brief moment before we have a break just to talk about the new developments for our organisation and the organisation that I hope you will feel a part of as well. Then we'll have a break and then move into the Home Care Review report. COVID-19 has been awful for our community. It has had a really massive impact. And I remember when the first lockdown happened, my eldest daughter was living with me and about two of my grandchildren. I remember us watching the news and catching up on what was happening with COVID. And I remember saying to her, there's a lot of black people that are dying from COVID. There wasn't that understanding of the negative impact on our communities, on communities of colour at the start. But I saw it. And so I'm not really surprised when it became clear from the data that we were indeed impacted, and lots of reasons for that. I guess, as awful as it was, one of the unintended consequences of the pandemic for this organisation, and I think for the African Caribbean community in Sheffield, is that it's often felt in recent years that we're perhaps a forgotten community of colour. Maybe because we've been here a bit longer, maybe there's an assumption that we have assimilated more or what, but it's felt like we are a forgotten community of colour. One of the unintended consequences of COVID, and I'll ally to that the whole issue around the death of George Floyd also, has been that where we didn't even know where the door was in terms of liaising with partner organisations in the statutory sector, we're at least getting our foot in the door now, and with some organisations we're firmly inside the door. I don't think that was planned by anybody, but I think that the stark realisation of the impact of social injustice and health inequalities that can't be denied has forced us to operate differently, has forced the system to listen to us differently. And I think that there's had to be an acknowledgement, certainly by the City Council, that the decisions that were taken on the back of austerity that disseminated the voluntary sector, and the black-led voluntary sector in particular, were wrong, went too far, cut too deep, and indeed should never have happened. And so we have, on the back of that opportunity, we've developed all kinds of links. So with the university, we are working with both the University of Sheffield and Sheffield Hallam around research and good local data in terms of our community and what our needs are. And we are hoping, we have planned in the new year a conference working with Sheffield Hallam University, which will, the keynote speaker will be a colleague from Croydon, who has done some work around health inequalities in the African Caribbean community in South London, and has done some, more than that, has come up with some suggestions about how we engage better, and he will come and speak at that conference for us in the new year. We've managed to get some additional funding from the Health and Social Care Foundation Trust, and the advert is out now for an equity officer, race and mental health. And that role has two key deliverables. Firstly, around restrictive practice on the wards, and by that I mean black people being overrepresented in the numbers of people who are taken into segregation and their liberty restricted on the ward. That's one element of the role. The second element of the role is around the prevention of black male suicide. And I shared with colleagues this morning that just shy of 7,000 people annually end their lives by suicide, and of that number, 75% are men in the 55 and below age group. That's a stark statistic to me. What we don't have in terms of data is the ethnicity, the ethnic breakdown of the people who are ending their own lives. And I meant to say this morning, and I forgot to say it, but I'll say it now. Many of you know that I'm part of the pastoral team at Duke Street in Sheffield, and I have personally officiated at the funerals of 6 people in our community who have ended their lives by their own hand. and 5 were men and 1 was a woman. So locally, there is an issue that we need to address. We are also doing some work around physical health, and so there is a project that we're working on with colleagues in Voluntary Action Sheffield and other voluntary sector organisations, funded by the King's Fund, looking at the issue of diabetes in our community, and getting good information, early intervention information out to the community around diabetes, how we prevent, how we manage. Diabetes runs in my family on my mum's side, so we have to be mindful of the impacts of diabetes. We're also doing some work around cancer. What the data tells us in terms of our community is that we present late, and when we do present, because we present late, the intervention is far more invasive. And that presenting late is a theme that runs across lots of the health inequalities. So that whole thing about getting good information out that Denise was talking about is really critical. That work around early intervention with organisations like ours that are very close to the community is really critical. And one of the things that we do to get that information out is that we partner with 6 of the longest established black majority churches and share information through that route, and we work with SADACA, with Cisco, with SIAC down the road, and make sure wherever there's a link into our community, we will work in partnership so that our community at least have the information. What you do with the information, it's entirely your choice, but at least have the information. We have been invited to be part of a number of organisations in terms of representing the views of this organisation, and more importantly the views of our community. And so SACHMA has a seat on the Board of Governors as an appointed governor for the Health and Social Care Trust, has a seat as a trustee at Voluntary Action Sheffield. A new grouping was pulled together post-pandemic to make sure that the voluntary sector and the local authority communicated effectively together, and there were 4 seats for the voluntary sector, and SACHMA has one of those seats. So our remaining close to the community, our constantly coming to you and talking to you is not about us bugging you, but it's about trying to be authentic in what we share with in the places that we go. But also, I'm Sheffield born and bred. I'm part of the African Caribbean community. If I had my life all over again, I'd come back as a Caribbean man. So we have something to contribute, and I think it's important that we do that. So there's lots going on for the organisation. There's lots for us to do. There are a lot of opportunities, and I think that, again, an unintended consequence of the pandemic and also the murder of George Floyd and others has been, it's no longer credible for organisations in the statutory sector to routinely have structures and barriers that keep us out. They have got to operate differently. Our remit is to hold their feet to the fire, to make sure that this is what continues. It's very easy to have warm words, very easy for warm words, but what I think our responsibility is as a community is to keep making sure that those warm words translate into action. So that's basically SACHMA and where we are today. We're always looking for volunteers, we're always looking for new trustees, we're always looking for people to get involved. So if something has stimulated you today and you feel I could do that, then see one of us. You will not be refused. There's always something for somebody to do. So we're going to take just a quick break now, just for 10 minutes, and then when we come back we will deal with the review of home care from an African Caribbean perspective. Thank you very much for your time. Sorry, so just a question. Yeah. Absolutely. Yes.
Thank you.
No, I'm just saying that David said about lots of black people in particular dying from cancer because of late presentation. Well, I'd like to argue with that because I have had, both my parents died of cancer, and they've been complaining and going to the doctors, and they've been told, oh, it's this, it's that, it's whatever. And they haven't been sent for the investigations till it was too late. A nephew died again because of lack of investigation. So I think that's an area we need to really take up.
I think that's a really reasonable challenge, and I think it's an accurate challenge. I'm old enough to remember Dr. Singh. Who remember Dr. Singh? Everybody, because the view was we were not getting what we needed from the system, everybody headed to Dr. Singh. He made a fortune out of us. I'm not sure that he tried to inject my head when I had a migraine, and that made me think, I'm not sure about. But I do think there is something about not getting the appropriate response. And there is something about us presenting late, but there's also something about the data. Because the data in terms of ethnic monitoring in health is not good, it's not accurate, it's not routinely collected. So I think the focus on cancer, all of those things may be right, all of those things could be challenged. What I think what we are tasked with doing is improving the outcomes. I remember my mum was ill for quite a long time, and backwards and forwards to the doctor, couldn't get anything from them, and then she ended up in intensive care. So yes, there are issues, but I think it's a complex picture. And we'll just take, unless there's another burning question or comment, we'll just take a break for 10 minutes, and then we'll come back for the home care review. Thank you.